Hello everyone, today we're going to talk about a very important topic, rash symptoms of HIV. It is very important to recognize the symptoms of HIV as soon as possible, since early diagnosis and treatment will prevent serious illness. Early treatment will also reduce your chances of transmitting the virus to others. Rash symptoms of HIV develop in 50 to 90% of people who are infected, usually beginning 2 to 4 weeks after exposure to HIV. The initial group of signs and symptoms is referred as primary or acute HIV because the signs and symptoms of primary HIV may be similar to other common illnesses such as mononucleosis. Most of people do not initially realize that they have HIV. However, HIV is highly contagious at this early stage because there are a large amount of viruses in blood and other bodily fluids. Recognizing the symptoms early, being tested for HIV, and starting HIV treatment as soon as possible can help to decrease the risk of transmitting HIV to other people. Who is at risk for HIV? HIV is usually acquired through sexual intercourse or exposure to infected blood or body fluids. This can occur during sexual contact with people with HIV, especially if you have unprotected vaginal or anal sex, or by sharing needles and syringes used by a person with HIV. Transmission from a pregnant person to her baby may occur during pregnancy, birth, or breastfeeding, although this is uncommon with the use of HIV medication during and after pregnancy. HIV infection is not spread by casual contact. Certain individuals may have an increased risk of HIV, including men who have sex with men, people who use injection drugs and share needles or drugs, sexual partners of people with HIV, people with a history of sexually transmitted disease, victims of sexual assault, men and women who have unprotected sex with multiple partners, men and women who exchange sex for money or drugs or have sex partners who do, anyone who is accidentally stuck with a needle or a sharp in healthcare facilities, people who received a blood transfusion or other blood product before 1984. Now, let's go immediately on HIV symptoms. Starting from early HIV infection, starting from the more common symptoms, there is body-wide symptoms. The most common body-wide signs and symptoms of acute HIV infection, it is fever. The temperature which goes above 100 degrees Fahrenheit or 38 degrees Celsius. The sore throat, headache, muscle and joint pain. These symptoms last approximately 2 weeks. During the second week of illness, most people also have painless swelling of certain lymph nodes, including those in armpits and in the neck. Although the lymph nodes decrease in size after the first few weeks, swelling can linger. Looking at the more skin and gentle symptoms, many people also develop rashes of the skin about 2 to 3 days after fever. The rash usually affect the face, the neck, the upper chest, or may be more widespread. The rashes usually last approximately 5 to 8 days. One characteristic feature of HIV is open sores and ulcers. These sores or ulcers can develop in months. The esophagus. The esophagus is a tube that extends from the mouth to the stomach, the anus, or the penis. The ulcers are usually painful. However, only a small portion of those with acute HIV develop these sores. The digestive symptoms. Many people with acute HIV, they develop nausea and vomiting, diarrhea, and lack of appetite. You can even develop weight loss. The respiratory symptoms. A dry cough is usually the only respiratory symptom associated with primary HIV infection. Those are acute the symptom that you can see immediately after getting infected with HIV. If HIV is not treated, the virus will cause progressive weakening of immune system, a process which occurs different rate in different people. Once significant damage to the immune system has occurred, this typically takes at least 7 years. People with HIV can develop infections that are not usually seen in people with normal immunity. This opportunistic infection can cause serious disease in patients with advanced HIV. Depending on the opportunistic infection, symptoms may include shortness of breath, blood vision, fever, and weight loss. One of the most common opportunistic infection is yeast infection of the mouth or esophagus. Yeast infection are caused by candida and fungal organism that is normally found on the skin and in the mouth, intestinal tracts, vagina. In healthy individuals, certain yeast infection can occur in people without HIV. Example, like vaginal infection. Although people with HIV are at higher risk for this and the other type of opportunistic infections, the candida of the mouth, also are known as thrush, causes cream-colored, slightly raisin patches in mouth, soreness, and easily bleed. Candidiasis of esophagus may cause difficulty in swallowing. However, with diagnosis and treatment of HIV, the immune system can improve. Then, the risk for opportunistic infection goes down. While the immune system is recovering, certain medication can help to prevent any opportunistic infection from occurring in the first place. Now, let's go to testing. Testing for HIV is the only way to determine if you have HIV. Testing is encouraged because treatment of HIV is highly effective and is generally well tolerated. In addition, learning about infection can improve your chance of living longer and being healthier. Furthermore, knowing if you have HIV and taking precautions can greatly reduce your risk of transmitting the virus to others. If you have learned something new, please leave a comment. And if it's your first time to be here, please subscribe.